everyone, if you have a degenerative disc, sciatica, a disc herniation, or a disc bulge, you really need to watch this video. What I'm going to do is I'm going to demonstrate the gold standard in degenerative disc disease treatment, or disc bulge or disc herniation, which is also called a prolapse, a disc prolapse, or a disc protrusion. This, hands down, is the gold standard. It's a mixture of an osteopathic and chiropractic technique. It's been taken further by the chiropractic profession. Dr. James Cox is the inventor of this technique. His father was the inventor. Dr. Cox, who is still with us, is pushing that technique even more and just doing so much research. There's a ton of research out of Indiana University. Feel free to go there and look up their research. But we're going to go ahead and treat this young lady here who has a degenerative disc, a very severe degenerative disc. She's young. She fell on the ice right on her tailbone, slipped, and now has a severely degenerative disc. Luckily, she does not get sciatica. So first, what we did with her, we did spinal decompression, or some call it traction, spinal traction. So we did that first. We gave her some heat, warmed her up, and then I pulled out the big guns. I lasered her back, and I'm not going to show you all that treatment. Spinal decompression, it's pretty boring to watch. It just separates her body. We put a strap here, and it separates and opens up the space in the lower back and the discs. So we did that already. We did some heat, and then we did some cold laser therapy around the QL muscles. Now, what I just spent the last 5 to 10 minutes doing is loosening up all the muscles here along her spine. When Cox flexion distraction technique is done, without the loosening of the muscles and the soft tissue along the side of the spine and the lower back, you're just not going to get as good results. So we spent, again, the last 10 minutes just loosening up all these muscles here along the side of the spine, the quadratus lumborum muscle, the multifidus, and the glutes. And it's painful. She'll probably shake her head if I ask her. I already know the answer. It's uncomfortable. The muscles are sore. There's trigger points in there. So we did some myofascial release and some trigger point releasing in that area in the lower back. And now we're going to jump right into Cox flexion distraction technique. Now, not every chiropractor does this technique. You need a special table that does this. See how the table goes up and down? See that? So you need that first and foremost. And you need a proper table. So again, not all chiropractors do this, and also some chiropractors that have this equipment are not certified in the technique. If you haven't gotten certified or taken the courses in this to get certified, then you're not doing the technique properly. That's the bottom line. So there are some chiropractors, though, that got certified in the technique and maybe haven't renewed their certification. That's okay. Once you're certified, you're always certified. But it's always important to keep updated on the latest research, and there's always new research coming out on this technique, thanks to Dr. Cox himself. And what I'm doing here is foraminal gapping. So you see my hand is placed right above where she has the degenerative disc. It's her bottom disc that's degenerative. So I can go as low as I want, just stay above, stay at L4 and above. And I can even go down to L5, because it's the L5S1 disc that's really degenerative for her. And this feels like a really great stretch. It seems so gentle, but it's extremely effective. If, again, you're suffering from degenerative disc disease, disc prolapse, disc protrusion, or sciatica or leg pain. And then we're going to go all the way down to L5 here. Again, this looks really gentle, but it's extremely effective, and the patient feels it. It's pretty intense. Every time we have patients leave, they always say this is their favorite. A lot of times people like to get their backs cracked and put on their side. That's not the best technique for a degenerative disc or a disc prolapse or protrusion. It works, but it's not the best technique. This is hands down the gold standard. So now we're going to traction the table out while we do flexion distraction. You okay? And you never want to feel pain down the legs. So the patient should never feel any pain shooting down their legs while I'm doing this. So if you have any pain shooting down your legs or in your feet or legs, okay, let me know. Do you?
No.
Good. So there are certain protocols we take ahead of time to tolerance test the patient. We didn't do that here because she's already had this technique done. We've already tolerance tested her in the past. And we're going to traction the table out a little bit more. She also has one leg shorter than the other, so we have a heel lift in her shoe to equal that out. She broke her tibia and fibula many years ago in the same accident that she hurt her lower back slipping on the ice. Okay, now she hasn't had flexion distraction done in a while, so if I do too much the first time, it could be pretty uncomfortable. She could, be pretty sore tonight. But if you are sore, by the way, tonight, that's normal. Tomorrow you should be fine, perfectly fine, and feel much, much better. Okay, so we're going to go ahead and adjust her pelvis here. And with this adjustment right here, I'm opening up that L5-S1 space even more by adjusting the sacrum down. And go ahead, bend your knees for me. You take a deep breath in. Good, and blow all the way out. And drop your legs down. Okay. And go ahead and turn over on your back. So, folks, that's how we do Cox flexion distraction technique. If you guys have any questions or comments, feel free to comment below. And please, if you got anything out of this video, I hope you can hit that like button, hit that thumbs up button, and don't forget to subscribe. We're coming out with 4 videos every week. I appreciate all of your help. Thank you. Thanks for watching.